y'all, my name is Kazon Allen, and this is another episode of the What Podcast, Wellness, Health, Advocacy, and Transparency. I am a Bank of America intern under the CoPPS IPH and under the lovely Dr. Sheffield. For today's episode, we have a special guest, and his name is Dr. C. Perry Brown. Dr. Perry Brown, how are you doing today?
I'm doing fine. Thank you for the invitation.
Thank you for being here. So, many viewers don't know who you are and what you do for the FAMU campus. Can you give a brief synopsis of who you are?
Okay, well, as you mentioned, Perry Brown. I'm a professor of Epidemiology and Biostatistics at the Institute of Public Health, and I've been here for 28 years.
What made you decide to do a whole career and study epidemiology? And what is it?
Well, epidemiology is academically the study of disease. It is a discipline that's concerned with and focused on how disease and other conditions exist and occur in populations. And a lot of what we do is identifying differences in the occurrence of disease in different populations and helping others to address some of those problems.
So, you have been here for 28 years, maybe even more. What lessons have you learned along the way?
One of the things I think we all have learned is that more data is better than some, or I should say some data is better than none and more data is better than some. The world works on information. Data is a part of the information flow. What epidemiology does is it provides the kind of data and analysis that allows for people in health planning, people in administration, people in intervention to formulate their programs to address the needs that are identified through epidemiologic studies and analysis.
And another thing you are teaching is biostatistics. What is that, and what made you decide to do biostatistics as well?
Well, biostatistics is a field of mathematics. It's a field of statistics. Statistics is applying mathematical procedures to data in order to identify trends, to identify relationships. Those relationships and trends are then communicated to health educators, to legislators, so that the best decisions can be made, and those decisions have to be made on the basis of data. Data talks, and the other stuff walks.
So, growing up, have you ever knew you was going to have this field of study or want this growing up?
No, growing up I wanted to be a physician until in high school I got that D in algebra, and that killed it for me. But I gravitated towards biology, and I started college as a biology major. I saw myself as becoming a high school biology teacher. Along the way, though, I was drafted. I was sent to Vietnam. Some of the things I experienced and I saw in Vietnam, no, I was not in combat, but I saw things. I saw garbage and trash along the side of the road. I saw villages that were populated by people who had missing teeth, who had infirmities, who had things that brought to mind the question of who's responsible for this. When I came back to the United States and went back to college, I asked the same question: who's responsible for health? And someone says, well, there's something called public health. Wow. I took a course. It was amazing. And as a result, I said, okay, biology high school teacher, kicked him to the curb. I said, I want to be in public health. And then I took a course called Introduction to Epidemiology. And that was it. I was focused on becoming an epidemiologist, initially at the master's level. And during my master's program, I had an opportunity to go overseas. At that time, I was working for the World Health Organization, and the opportunity was to go to Bangladesh to work in smallpox eradication, which is the only disease that we've eradicated off the face of the earth. And that experience was incredible, working with very dedicated people in a country where no news was usually good news, because there was famine, there were floods, there were hurricanes. They had smallpox, which killed 1 out of every 3 people who got infected. We were successful in that, and I came back, I finished my master's program, and went into the doctoral program.
And you went to Bangladesh, but you also visited other countries like South Africa and I think Brazil, right?
Mm-hmm.
So what are some things you learned from traveling?
Well, in chronological order, during the HIV, we're still in an HIV pandemic, I had an opportunity to go to Congo, and I was introduced to and worked with some very, very dedicated pharmacy faculty at the University of Kinshasa in the College of Pharmacy, they had developed an assay to quantify the amount of virus that a person was infected with. That was enlightening. I had an opportunity to spend 3 weeks in the upper Amazon in Brazil, and I was at the Tropical Disease Center in Manaus, Brazil, where they trained physicians and other medical workers in infectious disease treatment as well as epidemiology. I had an opportunity to visit their HIV clinic, their infectious disease clinics, and to go off into the villages way up in the upper Amazon, where you could only get to it by a plane or a boat. So those were interesting experiences. Thailand for an HIV conference. And in South Africa, I was there for 5 months on sabbatical. I was teaching biostat. But in total, what I've come to realize is that what happens somewhere can affect everywhere. What happens in the rainforests of Congo can affect everywhere. And we see that with Ebola. We see that with Zika. We see that with any number of, and we saw it with COVID. Started in China. There were only a few countries in the world that were not affected by COVID-19. And so I had an opportunity to work with the State Health Department with the COVID-19 response. That was also enlightening, but it reinforced what happens somewhere or anywhere can affect everywhere.
And was that like your motivation to travel internationally and to uncover all of these diseases?
No, those opportunities actually just came up. I have taught infectious disease epidemiology. The traveling informed my teaching. It reinforced some of the principles that we talk about in the course. And so being able to provide some real-time, real-world experiences just enhances and enriches the student's experience. So I'm not just talking about rules and regulations and talking about procedures. I can add to that my own personal observations of what actually occurs in the world.
So my next question is, what made you decide to teach here at FAM?
A job. Sometimes those relationships and friendships that develop, they actually open doors. When I was at the medical school in South Central Los Angeles, Charles Drew University of Medicine and Science, I had a project funded by CDC on diabetes prevention in inner city housing. There was a parallel project here at FAMU headed by Dr. Otis Kirksey, and that project was disease prevention in rural communities. Dr. Kirksey hosted us from Drew for a 2-day conference here, where we compared the similarities and differences of our respective projects. About 1.5 years later, the public health program here at FAMU was approved by the legislature, and the Governor Lawton Chiles signed the legislation that established the Institute of Public Health. My director, Dr. Cynthia Harris, was looking for faculty to start the program. She asked Dr. Kirksey. Dr. Kirksey said, I know this brother out in Los Angeles that you might want to talk to. Dr. Kirksey called me. Dr. Harris and I had our initial conversation, which lasted 1 hour and 15 minutes. We vibed, as young people would say. And the rest is history.
So how is it important to you to teach many students who are predominantly African American about these diseases that are mostly impact their communities, like HIV and AIDS?
Okay. Good question.
Thank you.
It's important for this reason. All too often, we have individuals who are absolutely, beyond a shadow of a doubt, well-intentioned, who are involved in research. And sometimes there's something that's qualitatively missing in the research, and that is the lived experience. The lived experience is being black. Someone once said at a meeting that why is it that all too often they, meaning non-blacks, are telling us about us? Epidemiology, and part of epidemiology is involved with data analysis, interpretation, and sometimes that interpretation is nuanced by the background of the person doing the analysis. It's important for the field to be as diverse as possible. It's important to have individuals who are Native Americans, who have cultural competence in their populations, in their communities, to be able to do the kind of research, to be able to do the kind of analysis and interpretation that is more correct than if I were to do it. One of the things that I've come to realize over this course of my career is that in some instances I am culturally incompetent. I would not be the best individual to do some aspects of research in Latino populations. I've learned that. So coming here and teaching and training what we call the next generation, or since it's been here 28 years, several generations of public health professionals, it's important for them to go out into the world. And it may sound just kind of trite and overused, but to go into the world and make a difference. To go into the world and go to organizations and say, here I am, here's what I know, here's what I can do, and here's what I can teach you about my community, about my population, where I come from. And do so armed with statistical knowledge and abilities epidemiologic knowledge and abilities. That's critically important. Critically important. And we should not stop doing that.
Just like how you learned and gathered many lessons from different communities, I know you heard the saying, you can't teach an old dog new tricks, but have you learned any lessons from your students while teaching?
I learn every year from my students. One of the things that in our curriculum, I'll start with the doctoral program. In our doctoral program in Epidemiology and Biostatistics, the doctoral students select their research project for their dissertation. Oftentimes, it's something that I, as their preceptor, I, as their major professor, I don't know anything about it, but they have an interest. In the process of a couple of years of interacting on a weekly basis, I learn. Their analysis sometimes is fairly complicated. I learn. And so it's very comforting in knowing that at the doctoral level, I've got students who are going out into the world that are smarter than me, more knowledgeable about certain things, and perhaps even more methodologically attuned because they've spent a couple of years working on a dissertation. I've supervised it. I can say, yes, this is a good idea. They have content knowledge. I develop more content knowledge by working with them. So, and I'll say at the master's level, basically the same thing. Master's students do a research project, we supervise that project. Most of the time, that project is in an area that I don't know a whole lot about. But when they graduate, I know more about it.
So with learning and also being a teacher and a mentor, what was the most challenging part of your career?
I would say a challenge, and it's not an insurmountable challenge, a challenge that I think I may have experienced is when a student says, I'm interested in epidemiology, but I don't like math. If nothing else, epidemiology is all about math. It's about using math, mathematical procedures embedded in statistics to analyze data. What is data? Data is information collected in a population that we subsequently analyze. And the analysis tells the story of everyone who's represented in that data. And as I mentioned, telling the story has to be nuanced in looking at certain aspects, certain relationships. What does it mean? What do those relationships mean? Asking the question, why? Why is it that African Americans, just for an example, African Americans make up about 40% of new cancer cases, but we only make up 15% of the population? We should make up 50% of new cancer cases, shouldn't we? But we make up 40%. Why? Well, part of epidemiology is involved in trying to answer the question of why. And that has to do with, well, are there behavioral differences? Are there exposures that more often occur with African Americans than with other populations? The death rate is higher. Could that be a matter of treatment? Could it be a matter of effective treatment? Could it be a matter of time at which people get diagnosed and treated? Could it be all of the above? So these are the kinds of things that epidemiology and the importance of it, the importance of having a diverse epidemiologic community is that people will bring nuanced interpretations to data analysis that sometimes other people will miss. But going back to your question, the challenge, someone says, oh, I want to be an epidemiologist, but I don't like numbers. That's a challenge because we work with numbers. And I would ask you, as an example, now you're a journalism major.
Absolutely.
Have you ever gone down the street, you pass a gas station, gas is $3 a gallon. You pass another gas station and gasoline is $4 a gallon. You probably have asked yourself, well, what's the average price of gas? Well, it's 3 plus 4, which is 7, divided by the number of gas stations, which is 2, and you come away with $3.50. You have done statistics. You've calculated an average. In statistical terms, we call that a mean. If you have ever asked the question, why is it that some illnesses occur more often in this population compared to that one? And we all kind of do. That's a classic epidemiologic question. And in epidemiology, what we do is we go forward to either find the data that helps us answer that question or collect the data that helps us answer that question. A challenge has always been individuals who have convinced themselves that they can't do math. Everybody does math.
Because math is everywhere.
Everybody does math. When you go to the store and you come out the Dollar Tree and you should have had 27 cents change and you only got 17 cents change and you say, but you owe me another dime, you've done math. So I think it's kind of like a false flag. Somewhere along the line from 3rd grade up through college, people are convinced that they don't know math or they're not good at math or they don't like math, but they do math all the time. So one of the challenges is to get people to understand, to get my students to understand, it's something that they've been doing. We're just going to take them to another level.
Okay. And my last question is, it's no news that you're retiring from the 7 Hills. So what is one thing you hope that one thing you hope to leave? What you see wants to be here at FAMU?
Okay. Well, I'm going to channel my master's and my first doctoral advisor in graduate school who retired at the beginning of my doctoral program. He told me, I'm retiring, but I'm not retiring from the university, I'm retiring to the university. And by that, I mean some individuals retire from the job and then they just go away. The academic environment allows for people to stay involved and invested in the university by way of what I consider an honorary title, which is called emeritus. Well, Professor Emeritus is someone who has been evaluated and judged to have had a career of service to the university. And I think I may have been recommended for or nominated for emeritus. The results of that go through the faculty senate. I'll probably know something at some point, maybe in the fall. So my plan, if all goes well, is to retire to FAMU rather than retire from FAMU, to continue to be involved in student research, to participate on doctoral dissertation committees. At some point, I will continue to write. I will continue to conduct research, and if asked, perhaps to teach a course now and then, on my schedule. I'm looking forward to that. I've got several projects that I've started.
So you're not stopping at all?
Hmm?
You're not stopping at all?
I'm not stopping, but I'm slowing down. And the beauty of Emeritus is that it doesn't require me to be somewhere every day.
I just wanted to say thank you so much for not only being a professor and a mentor, but helping so many predominantly black students get into a career where they didn't even know of, and opening the job market, opening their eyes to something that we didn't know of. So I want to say thank you so much and having that part of your legacy.
Thank you very much for the opportunity to share my story.
No problem. Thank you so much for being part of the What podcast. Hopefully you enjoyed your time.
I always enjoy talking about Epi.
So that is all, guys. Thank you for joining and watching this episode. Don't forget to like, comment, and subscribe. And stay healthy, stay wealthy. And that's all. Thank you so much.